Sean Askham, I'll officially call this meeting to order. Chief, could you lead the pledge? You're in the room there.
Yes. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, sir. All right, we'll do a quick roll call. Melissa Appleby. I'm here, Sean Askham. Jim Baldus. Good here. Mike Berry.
Mike Berry's here.
Yep. All right. Chief Bolter, obviously you're there.
Yes.
Maria Capriola, Town Manager.
Here.
All right. Kristen Formanek. I heard Jennifer Gutanis. Kevin Kowalski. Mark Kritz.
Here.
Okay. Mike Long. Melissa Marquis. Mark Mazzaro. Sarah Nielsen.
Sarah's here.
Sarah. Chris Peterson, I heard. Mark Chris. Tom Roy. Nancy Sheets. Karen Stewart.
Good morning, I'm here.
Morning, Karen. Neil Sullivan.
Jeff, good morning.
And last but not least, Gary Wilcox.
Good morning, everyone.
All righty. So we have the minutes before us. Are there any changes, questions, comments, otherwise? All right, those minutes will stand. I have no public audience. Maria, nothing's been emailed to me. Has anything been emailed to you?
No comments received.
Okay, thank you. All right, we'll move right to Farmington Valley Health District and Jennifer.
Yeah, good morning, everyone. As of last night, we had 8,700 confirmed cases in Connecticut, 335 deaths, and 31,700 individuals tested in the state. In the Farmington Valley, our numbers continue to rise. We have about 79 or 80 cases as of last evening, 21 of those in Simsbury. We continue to do follow-up with all of our cases to do contact tracing, isolate the sick, and quarantine family members. There is some good news, and that is that some of our earlier cases that we've been following have reached the criteria for clearance, that is 3 days fever-free, improved symptoms, and at least 7 days from onset of first symptom. We also have some families in general are doing an exceptional job at isolating their sick, and we've actually been able to clear close contacts after 14 days as well. So I just want to, extend a thank you to our community members for, one, the work that they're doing to support their families that have sick family members, and also to the general public that are really heeding the advice to social distance, stay away, be safe when they are out doing critical things like grocery shopping. And we need to just continue those efforts as our Connecticut numbers continue to rise. And we have to continue to double up on our efforts there. In the last week, we have issued a number of specific guidance. We issued a letter to our emergency managers and our town officials regarding personal protective equipment and donations, requesting that there be a single donation location within our towns, just so that we can really prioritize what types of masks are going where. Now that we have, groups of individuals making the homemade cloth masks, those are great for people that are going out to grocery stores, that are doing errands for others, dropping off food, etc. We need our surgical masks and N95s for our healthcare providers and those that are dealing with people with symptoms. We've also issued a memo and pushed out a memo to personal care assistants and home health aides, those that are not affiliated with a professional organization like a VNA. There are a lot of independent home health aides that provide support regarding activities of daily living. Many of them, live paycheck to paycheck and may not have access to the types of information and guidance they need to both keep themselves healthy as well as protect those that they are caring for. So this has been a concern and a challenge, we're working with independent living facilities and others just to make sure that both the consumer of the home health aid services as well as the home health aides get some of the guidance that they need. We also issued, I don't know, the days are running together, but a memo regarding the general use of face masks, encouraging, consistent with CDC guidelines, encouraging the general public to wear these face masks or some type of a face covering while they are out in public running errands, etc. And I have fielded questions from some of our municipal partners regarding that same issue for, individuals, our municipal employees, not first responders because they have good guidance available to them, but public works, dial-a-ride, bus drivers, things like that, who interface with the public. And I just want to emphasize that the use of face masks is in no way a replacement of our social distancing recommendations. Even when you have a face mask on, people should be maintaining that 6-foot distance as best as possible. The last thing I'll report on is that the state health department has reported that they do have some state-purchased PPE. They are asking the 5 regions and local health departments in collaboration with their emergency managers in each of the 5 regions to set up points of distribution to deliver these kind of push packs of 100 and 500. What exactly is in that push pack? I'm not quite sure. I think it includes gloves and masks to our acute care healthcare system. So not our hospitals and not our long-term care or assisted living because they're getting theirs directly from the state health department, but rather our urgent care centers, our dialysis centers, our visiting nurses, other primary care physicians, etc. So we are leaning forward and working with Avon, and the Avon will be our point of distribution for this, but we will be asking for support. It'll be a stealth operation. People will have to register. That's the piece that we're working on now. The state did not have a strategy for that, and they've handed that off to the region, so we're quickly working on that to understand how we would prioritize. It would be a drive-through with limited staff support needed for it. So that is something that we will be working on and looking to do probably sometime next week. With that, I think I will stop.
Jennifer, thank you. You doing okay? You got a lot going on, my friend.
Yeah.
We appreciate all your efforts. Folks, any questions for Jennifer?
Yeah, Jennifer, it's Neil Sullivan from the school system.
Hi there.
If we have custodians into work, but they're not interfacing with the public, is it necessary for them to wear the cloth masks?
I don't believe so. I mean, they're in large buildings all by themselves. They can keep their distance from each other. You know, masks aren't a comfortable thing to wear all day. So in that environment, I would say no.
Okay.
Good question. Other questions for Jennifer while we have her?
Yeah, Jennifer, this is Kevin Kowalski.
Hi there.
Hey, the PP pushback, you're planning on standing that up next week? Is that what you're looking at?
Yeah, it all depends on how quickly we can identify the acute care healthcare providers within our region and district. I can easily get a handle on urgent care, dialysis centers, our VNAs, hospice, et cetera. It's the primary care docs and all of those, affiliated with, a pro-health physician, a Starling Medical Group, et cetera, that are going to be challenging.
Okay, those are the priorities, though, right? It's not for first responders, then?
No, the first responder PPE is coming through Demis, as I understand it.
Okay. So they haven't put this all together yet, then, under logistics?
No, I actually think they're handing off the logistics to the region. So we do, as a region, actually have a regional distribution site plan and operating guide. I mean, I have no doubt that the regions will be able to pull this off in Region 3. What is the challenge is the pre-registration and the prioritization of who gets what when. And one of the challenges is the state has not communicated with us how many of these pushbacks we're going to get. And until we have that, we need to control this, as you know.
Yeah, no, I understand that. And that's why I'm trying to understand. Now, you're talking about the region, you're talking about the health district region or the health region, or are you talking about the Demis Region 3?
So Demis Region 3 will receive all of the pushbacks for our region, and then there are 6 pods that will be coordinated with local health and their emergency management partners throughout the capital region. And the Farmington Valley is one.
Yep.
We're one of the 6.
Okay, thank you.
You're welcome. Thank you.
All right. Other questions for Jennifer? All right, Jennifer, as I said, thank you so much for your work. And I know you have to drop off for another call, so we appreciate you making this one.
Yep, no problem. If anyone has any questions, they can give me a buzz. Thanks for all that everybody else is doing, too. All right, take care.
Thank you. All right, Maria, Town Manager's Office, and I know we have Melissa on the live stream as well. I missed her before.
Great, thanks, Sean. Our public buildings still remain closed to the public. We do have staff reporting physically into work on a limited basis for those tasks that can only be done in our buildings. Most of our staff who are working normally from Town Hall, the library, Eno, and the Simsbury Farms Administration Building are working remotely. Most of our crews, so the various crews in Public Works, the various crews in Parks and Recreation, are operating with modified work schedules, whether it's alternating schedules or things of that nature, as well as modified work practices. It's really important that we maintain our critical infrastructure, such as the wastewater treatment facility. All of the critical infrastructure is fully operational, and we are, again, trying to do that by keeping our workforce as healthy as possible for as long as possible. And so far, the alternating work schedules and modified work practices have been working very well for us. We have a number of facility closures. We did make the decision late last week to temporarily close the transfer station for folks who need additional recycling bins, if they need curbside bulky waste pickup, if you need a dumpster for some reason. We've asked residents to contact their refuse hauler, so that's either All Waste or Paynes. And they can get those additional services provided at curbside. We've also provided information on our website if folks need to dispose of paint materials. There's a website where people can go to look at sites for where they can dispose of those materials. We also still have our playgrounds, our skate parks, our basketball courts, our tennis courts, and our paddle tennis courts closed to the public. Following the last Public Safety Committee meeting, we did have larger, more permanent type signage made and installed at the various facilities, clearly stating that the facilities are closed to the public. At this time, our parks facilities that really are for passive recreation, they do remain open. So that's such as our open space parcels, our trails. People can still use our trails, but we do request that people utilize social distancing and keep safe distances from other patrons when they're out hiking and walking. We have a couple of governor's executive orders that are impacting us. We recently, on Monday evening, the Board of Selectmen adopted 2 programs related to property taxes. I believe we were one of the first towns in the state to act on that executive order, so I'm really proud of the Selectmen and the work that they did there. One is a property tax deferral program, and that is for qualifying individuals. They can defer payment of their property taxes, their personal property taxes or motor vehicle taxes for up to 90 days. And the second program is a low interest rate program for delinquent taxes. Normally under statute, the interest rate can be crippling for people. It's 18%. Under this program, it will be 3%. The Revenue Collector's Office will be administering these programs for us. We just issued a press release yesterday with some basic information and details as to how people can apply. And the Revenue Collector's Office has already begun to field inquiries from residents who are just very appreciative that the Board of Selectmen took this action on Monday evening. Another executive order that we have been implementing are around budgetary resolutions. We have extended our budget timeframe by 30 days. We're also monitoring our budget timeline very carefully. At this time, we are not allowed to hold public hearings open to the public, nor are we allowed to actually conduct a referendum. So the Board of Selectmen, to be cautious, went ahead and gave the Board of Finance the authority to adopt a budget if we are not able to hold a referendum. So that was something under a governor's recent executive order that the legislative body, which is the Selectmen, could give the budget-making authority the ability to adopt a budget if we are unable to hold a referendum. So I think we have all the nuts and bolts in place for that worst-case scenario if we're unable to hold a referendum. At this time, we're tentatively hoping to be able to hold a budget referendum on May 30th. But again, if that's unable to happen, we have a good plan in place to make sure that we have a budget in time for the new fiscal year. At this time, our meetings do remain closed to the public. We are accepting public comment through an email address, which is ebutler@simsbury-ct.gov. We are, for those meetings that we are still holding at this time, we are broadcasting those over SCTV. And we, at this point, are essentially our non-essential groups, meaning that they don't have a regulatory function or capacity. Those groups have not been meeting. We've been trying to, since our meetings are closed to the public, to do our best to really only have our regulatory bodies meet at this time. We also have a number of ways for our residents to stay informed. We've been using our news and announcement function, which people can sign up for through email. Our town website, we're regularly updating. Sorry, my seasonal allergies are kicking in this morning. We have a Facebook account, Twitter account. We've been every other week doing a public service announcement with SCTV. So it's been myself, Chief Bolter, Chief Baldus, Karen Stewart from the Ambulance Association, and Kristen Formanak, our Social Services Director. We will most likely be scheduling another public service announcement recording for next week. We just did another one at the end of last week, and those have been getting quite a good amount of views. The very first one we did had, I believe, over 2,300 views in total. And, of course, we're still doing our public safety weekly check-ins, which have been really helpful. So, again, I think there are a number of ways for our residents to stay informed. And that's what I have for this morning.
Thank you, Maria. Very well done report. And while you were very kind and gave the selectmen credit for our action, it was the work of you and Melissa and Amy and the rest of the staff that put us in the position to be able to act on those executive orders. So we did the easy part by saying aye. You folks did all the hard work getting it ready. So we appreciate that.
Well, thank you.
And to the comment of the signage, so Maria, Tom, Neil, Mark, folks, after our discussion last week, I really appreciate the action that everybody took with the schools, et cetera, to get those signs up. I've received a lot of feedback, and folks appreciate that with the clarity, and I think it has cut down on the number of folks using the sites from at least what I've heard at this point. So I really appreciate you guys acting on that so quickly. Thank you.
You're welcome.
All right. Any questions for Maria? Obviously, there's a lot in there, a lot of good stuff. All right, we'll move on to Kevin and Mike, Emergency Management.
I'll let Mike start off on his particulars.
Okay.
Good morning, everyone. Not much has happened since last week. We have been pushing out more of the notifications through WSIM, and we're trying to get as much information out to the public as possible. Kevin's going to be able to report more on what we're doing with the PPE as the search still continues. We are on the conference calls about every 3 days, but again, it's just more promises and nothing being delivered. So we're just waiting for things to kind of trickle down and get to us, and we're hoping that the surge that we're expecting really doesn't hit us. So with that, I'll turn it over to Kevin.
Yeah, good morning, everyone. Hopefully everyone's feeling good this morning. To size it up, basically it's kind of just a standby position that we're in. We're monitoring all of the conference calls through the state, through FEMA, and anyone else that has requested conference calling. We've gone through it trying to get information, and again, we're always trying to get the PPE. We've been fortunate from a couple vendors. We just received some in from a company in New York that makes them. They used to be a clothing manufacturer, and we just got them in yesterday, and we're going to take a look at them to see if it's a good value for us and good safety item. They are cloth, and they could be used for long term. So hopefully we'll be able to handle or get these and get an additional 500, which will kind of ease the support. We are handing them out where we can. We're again trying to prioritize the first responders in the event of a surge, so that the ambulances is well protected, as well as PD and the fire folks. So those have the priorities. We have not received any cloth donations, so to speak. We had 2 calls this week, and we told them how the process of dropping them off to the main firehouse into the vestibule and letting our dispatcher know, so that there's no interaction between our folks and the folks that are delivering them. We feel that's a safe way of doing it. And once we have that, we'll have an inventory, and we can let everyone on this phone call know that we have them and they can be deployed. Those are primarily going to be used for secondary use for our people, also businesses, Public Works will probably get some more, and things of that nature. If you need some, please give us a call. We'll try to scrounge some up from our inventory if you're in a bind. Yesterday we sent out 50 to DPW because they wanted to protect their people, and then we got a call from Sarah, Main Street, to see if we can get some out to some of the businesses. We'll do the best we can in trying to outfit, but again, we're not getting any more in, and with this delivery yesterday, it will be helpful. The other item that we just hopefully received this week, we ordered is face masks, face shields. They're plexiglass. They're being made by a local manufacturer. We were notified by Mike Payne that this company was making them in East Hartford, and we ordered 100 of them to give out or to try. So that'll be part of the first responder package too, going out to police, and if Karen needs some, to Karen. So that's ongoing, but that's the key right now. Is we're just out looking. We're out looking for PPE for our people should we need that. The other item, and I will send Jennifer an email that I forgot to mention, is we are getting daily notes on concerned areas or people that have the virus or a high risk of having it. And we're loading that into our CAD for our emergency first responders to take appropriate precautions based within the guidelines of the HEPA requirement of notification. One thing that's going to be really vital to us is that we get a follow-up on when these people get better, we need to take them out of the CAD. So that's going to be an important factor down the road that we're going to have to follow up on. That's pretty much it from our standpoint. I'll take any questions.
Thank you, Kevin. Appreciate all the work there. Any questions for Kevin and Mike? Alrighty. Chief, update from the police department.
Okay. Thank you, Sean. Good morning, everybody. Our staffing levels are good. The calls for service were low for the first couple of weeks. We saw that both here and throughout the entire state. But over this last week, we saw a slight increase in our general calls for service, both in town here and also within the region. And just to give a few examples, our number of calls that have gone up have been related to family violence, general disputes, and then calls related to mental health. So I just want to have everybody to keep in mind that services are in place still within all of our systems. Use 211 or call the police department for any information or any services that you may need, and we can either directly or indirectly provide those. Also, we have seen a very slight increase in criminal activity as well compared to the last couple of weeks. And just as an example, we had a motor vehicle that was stolen 2 nights ago. And so I just want to, gently remind everybody that, we can all together help prevent some of these crimes of opportunities, by locking our car doors, keeping our keys and our key fobs inaccessible. Obviously, there's been an increase in people attending our parks, and just please keep that in mind there, the general precautions of not leaving things in your vehicles that are available for people to see and for opportunities. So please be vigilant at this time. As far as PPE, we're in the same boat, and I'm thankful for everybody working together to try to get a good source of PPE for our officers as well as the other emergency responders and those who provide health care in town here. A special thank you, though, to Ann Baldus for crafting some very well done hand-sewn face coverings for our officers. And she turned these around very quickly, and they're very useful, so we certainly appreciate that. As far as the social distancing efforts, there is an obvious effort for that, but we'd like to encourage continued focus on that for those who have been following those guidelines, and then for those who have not, to enhance their focus on following those guidelines. And then just to wrap it up, a very large thank you for the tremendous amount of support and work from obviously people in this group and the immediate emergency management stakeholders, but also from everybody in town who has provided a significant amount of support and or just adhering to the guidelines put out by our local Farmington Valley Health District, by the town, and by the state. So thank you.
Chief, appreciate all that. Folks, any questions for the chief? All right. We'll keep going through this morning. We have Karen from the ambulance. Karen, how you doing?
Hang in there. Good morning, everybody. I'm probably going to echo most of what other people have said. We're still on the hunt for PPE supplies. We have seen a slight increase in call volume, and at this point are pretty much going on every call, assuming that the site is a positive site, which means that we're going through mass a little faster than I anticipated. But I think it's important to keep the crews protected and obviously to protect family members and patients that's going on the call. So still searching for some more, and we're good for now. I did have a pickup from the state last week, which was a little bit more than last time, which was nice. I got about 50 of the plexiglass type masks that Kevin had referred to, so I do have a good source of those, but I'm definitely going through the N95s faster than I anticipated, so we're going to need to try to find some more in the near future. I did take a survey through the state for our region where they asked how many I anticipated that I would need for next week in terms of masks, gloves, gowns, et cetera, so I'm not sure what the end result of that survey is going to be. I guess we'll probably have another pickup or ration date at some point. But otherwise, we're just keeping our fingers crossed and hoping that surge isn't going to hit us, and just in standby mode like everybody else said. And otherwise, that's all I really have to report.
Appreciate that, Karen. Any questions for Karen? All right, Chief Baldus, fire.
Yes, good morning. We continue to remain focused on keeping our volunteer staff safe and healthy, practicing all of the recommendations in terms of social distancing and so forth, cleaning up after themselves after each run and so forth, sanitizing trucks and sanitizing stations and all. Pretty much status quo. We're very fortunate. Our volunteer strength remains very strong. We don't have anybody that we've put into a self-quarantine or any kind of a concerned status at this point in time, which is great. So we're very fortunate in that regard. We are using online training and online meetings on a regular basis with our membership and our officer staff to maintain good communication and updating in terms of what our statuses are and any procedural changes that we need to make. So things are progressing there. That the PPE issue I think has been well covered with Kevin and others. We continue to look at that very, very closely. One thing that's important, again, as a public reminder, that we do not allow open burning, especially now with the transfer station being closed and there's no ability to dump brush right now. We hope people will just be able to put that aside for the time being, in their yards, but do not burn it. It's not allowed. And we know that there's a lot more yard cleanup taking place right now, but we want to make sure that we don't have those issues to deal with. Certainly, it could present a problem. So again, we ask for the public's indulgence on that, and remembering that there is not open burning that is allowed. On a somewhat happier note, we were able to pull off a very successful Easter Bunny fire truck hop last Sunday. This was done throughout the town. It was very, very well received by the public, and we certainly thank all of our residents and especially the volunteers who helped pull this off. I want to do a special thanks to our Ladies Auxiliary President, Steph Brown, who was the individual who kind of spearheaded this whole project and who actually put together the whole mapping program for the two fire trucks that were out for the day on Sunday. And if anybody is interested, we have posted a picture gallery on our website, which you can see at simsburyfire.org. So needed that little bit of sunshine, and it worked out great, and we're really, really pleased that we're able to do it for this community. And that's my report.
Chief, if I could just jump in on that, I think that was phenomenal on both the fire department and the Lady Auxiliaries part. And I can tell you, just in the street that I participated on, I mean, hundreds of people all practicing social distancing in their driveways, but just out enjoying a beautiful day. I think it was very much needed in this community, especially for those of us with little kids. And, for those moments when the fire truck came by, I can tell you, it's the biggest smile I've seen on my daughter's face in 5 weeks. So I really appreciate all the effort that went into that. And I know it was probably a long day for your volunteers, but it was phenomenally well done.
Thank you.
All right. And Chief, I did have a question. There's a lot of public support for our nurses and doctors at 8 o'clock every night, and that's obviously appreciated. But I believe there are some fireworks going along with that at some cases.
Yeah, I might be able to answer that. In some
Yep.
cases there is, and we're trying to take care of that situation locally, and
Yep.
hopefully it won't continue. Certainly it'd be something that we can post, please, no fireworks. It's still not considered to be legal, so if we could just re-emphasize that, that would be great.
Yeah, and again, not suggesting that anyway we not support our doctors and nurses, et cetera, but we don't want to catch anything on fire or hurt each other as a result of it. So, all right, Neil, Board of Education.
Yeah, as you noted, Sean, out of last week's meeting, we did get really right on the signage and had it up by Friday. So I want to thank Tom Roy and our Director of Operations, Andy O'Brien, and Mark Kritz, who were instrumental in making that happen, and thank Chief Bolter for collaborating to make sure that we got the messaging right. I've broken my cabin fever by going out to see, taking some drives around to see what I observed. We did have a couple of some basketball playing prior to last week after we had this call. Since then, we have removed the hoops like the town did, so that has taken away that temptation. And otherwise, my observation has been what you would want to see, which is, solitary dog walkers or, a couple of people walking through. The one exception I will note is there does seem to be a thing where a couple of times that I've gone in the high school parking lot, we do have our teenagers who are old enough to drive. It's certainly congregating, but in the spectrum of teenage behavior, it's literally like they back their cars into a circle, open the hatchback, and while observing social distancing, they're socializing. So that seems to be a thing that's happening. I've seen it three times that I've gone. There has been a small group of teenagers doing that. That would be the only thing I would say that I've observed that is congregating. But again, it's pretty responsible. The grab and go continues to go well. It's plateaued at about 70 students who come through, some multiples in some families, but it's consistently been at about 70 kids for the last few times we've done it. We are expecting the governor and the commissioner of education have targeted the end of this week, so either this afternoon or tomorrow, for further guidance about how long school closures in the state might go. So we're sort of expecting an announcement on that, knowing that we think it's going to, it's likely going to extend much further than right now. The guidance is only through April 20th, but we certainly believe that it's going to go much longer than that, and awaiting that announcement. And then I will note that our Board of Ed is holding its first meeting since the shutdown next Tuesday night, with our not open to the public. Our board chair and the superintendent will be in the meeting room, and everybody else is going to join remotely. So that's what I have for this morning.
Yeah, appreciate that, and again, appreciate the work to quickly address the playground and park usage there at the school. So thank you. Any questions for Neil? Tom Wright, Public Works.
Good morning. I think just to kind of echo what Maria said, we are working on keeping our crews ready to go using our split shift. The buildings and ground staff has been continuing their disinfection work to make sure that all of the folks that are still using our buildings, including the police, remain healthy. We actually have been asked to supply some disinfection chemicals to the Board of Education, and we're working on making sure that they have adequate supplies. Our household hazardous waste that was scheduled for later this month, April 25th, and that was going to be held in Farmington, had to be canceled. Our next collection is currently scheduled for June 13th. And other than that, we're just here to continue to support all of the other activities going on right now.
Thank you, Tom. Any questions for Tom? Right, Social Services, Kristen.
Good morning. We have also been very busy. One of the things that we are doing is acting as the main collection site right now for the hand-sewn face masks. We've done a lot of coordination with volunteers who are sewing them, and in getting supplies each week, we are putting supplies back out to the volunteers, and they're dropping masks off to us. Also, a thank you to Ann Baldus for the first batch of masks that we received that went to my staff. And we're now focusing on getting masks to all of the town staff that are still reporting to work, even intermittently, so that they will have masks while they're in the building. We're also still serving the community. We are taking individual requests for food resources and helping with grocery store gift cards. We're doing another large distribution this morning. We're going to be distributing food, toilet paper, grocery store gift cards, and we also have a special treat for our kids. Since we had to cancel our sensory-friendly spring fling, we've made up goodie bags with the items that we were going to use for that. And we were also given permission to utilize some of our Youth Service Bureau funding in a creative way. We have purchased some gift cards to Neckers, and we'll also be distributing those to the children in our families this morning. So we're really excited about that. And we are also still distributing our Hot Wednesday lunches to our seniors, and that's through McLean. We're grateful that they're still supplying those to us. We've been working really well with Public Works. They've been great in supporting these efforts for us and making sure that we're set up properly and we're keeping our social distancing during these distributions. And we've had great help from the library, making packets to give to our families this morning with, games and puzzles on paper for people to stay busy. And also a reminder, as the chief had mentioned, that services are still available to people. If you're in need, please call 211 or also go on the link to our website. We have a full listing of all kinds of resources that are still available to people, even if it's virtual. Things are still working. There is still help out there. And please reach out to us. We are still answering our phone calls daily and returning messages as well as emails. I think that's my report. Any questions? I'd be happy to take them. Thank you.
Yeah, hi, Kristen, this is Kevin. Sean, if I may ask a question?
Of course.
Kristen, on the cloth masks, as you are receiving them in, is it possible for you to give me an inventory and the process of having people get those masks going forward?
Sure, I can share that with you. We just started with our inventory yesterday. We received our first big batch, and we're keeping a list of who is requesting them. Today we're going to be pushing back out to the town staff and getting them covered. And then from there, we're taking it by request. We did have a request from some staff at UConn, a branch here in Simsbury. They were looking for some masks, so we're going to try to accommodate them as well.
Okay, if we can just kind of keep track so that it's not a duplication of effort where we were to be the central location, and that's fine. You want to maintain that, no problem at all. I just going to try to manage the inventory on what we have in stock and who's getting them and how we're distributing them. That's just so we know.
Okay, yes, totally understand. And we're not collecting any other types of masks or equipment. It's just the hand-sewn ones.
Understand.
Do you want to connect later today on how we can better communicate or best communicate on that?
Yeah, you can just send me an email is the best way.
Okay.
That'd be great. Thank you.
Will do.
And Kristen, just a personal note, as I continue to learn so much through life here. My wife, as you all know, is in her third trimester. She's pregnant, and we learned last week that the doctor's offices do not have any masks for their patients coming in. So they're taping paper towels to these pregnant moms' faces. So I don't know if there's an opportunity to connect in those spaces with maybe some cloth masks or something.
Oh, yeah, I think that, we can work that out with Kevin, depending on inventory and.
Again, not looking to solve the world's problems, but just something that might pop up. We're covered locally now, but.
I was going to say, I think it's, at the very least, definitely get one for your wife. I'm sorry that she has to experience that.
No, we took care of her. I'm just worried about other folks that might not know where the access points are.
Yeah, we have put up information on Facebook, and we can continue to do that too.
Okay, thank you, and appreciate it. I know there's so many people to keep informed. You guys are doing a great job. All right, Nancy, VNA.
Good morning, everybody.
Morning.
I have to say, there's a part that's fun being sort of towards the end, because I sit back and I listen to how we're all just sort of waiting for the calm before the storm, and I really do think that I'm so grateful that I'm a part of a community like this, because we are all really so ready, and I really do hope and think and believe that we might actually make it through this without being as hard-hit as other places, because we all take so much time to kind of do the steps and to put so much effort into getting ready and getting our community ready. I do want to report that we have had an incredible outpouring from all types of groups, and so right now I'm really confident that we have a fair start of the PPE, so that if when we get patients, we're really more than ready to take care of them. I will let you know, we've gotten 2 referrals from UConn already of patients that are COVID positive that they're hoping to step down into the community, and they wanted to know if once it got to home care if we would take them, and we told them that we would. So I do believe we'll start to get some. I'm really hopeful that it won't be an onslaught that none of us can fully manage, but we really are ready to manage the quite a few. So I'm really happy about that. I want to be cautious about saying this part, but I do have more cloth masks right now than I might need, depending on what the future brings. So especially if there are any first responders that you all know that still need something within our town, please give me a call. I really want to make sure that all of us stay healthy. I might be able to help out with that. That being said, my staff has also put out a two YouTube videos with regards to how to properly put on and take off equipment. Granted, it's for the home care setting, but this stuff is different than what we've done before. It's not typical to be dealing with potentially isolation patients out in the open world. So I'll just refer you to YouTube if you want to take a look, and just know that the nursing staff here, I have plenty of nurses that are available at any time if you want them to come and show your staff or practice with them, or even just do a video conference with anybody. So we could be happy to do that. I'm grateful that we're all just sort of sitting here, although it's kind of eerie because I'm not sure what the future's going to bring, but I do think it's going to be okay. I have to admit, too, as a nurse, on all of my solitary walks, I'm so touched by the outpouring everywhere I look. Kids have painted signs. They have used chalk, sidewalk chalk. There's all types of thank you first responders and police department and fire department and nurses. And I got to say, it really does feel good. I guess that's it.
Nancy, appreciate that. Thank you. And I appreciate your perspective. You're right. This is an outstanding group, and I think everybody's well prepared. All right, Sarah, Main Street. How are our businesses doing?
So the business community is continuing to hold on. I want to thank my business community. They are, even under these stressful times, as Nancy mentioned last week, they are still continuing to donate, whether it's food for our healthcare workers and our first responders, whether it's, stuff for the kids, you name it, they're still continuing to step up to the plate. Just a reminder to the general public and also to this group, Main Street is continuing to update our business and restaurant list on shopsimsbury.com and on our Simsbury, Connecticut Facebook page. So we continue to update, and our last update was less than 48 hours ago, the list of businesses that are fully open, modified opened, or closed, to save some unnecessary steps and also to communicate with the public what is available so that they're, prepared and they can go safely to get the things that they need. I'm working with all of our businesses right now on the funding issues, programs, loans, grants, et cetera, and also trying to field questions from, for example, Cameron from the Ambulance Association on, different ways that we can help the nonprofits and our volunteers and our first responders as they make it through this unprecedented time. So we're continuing to work on that, and if anyone has any questions, I'm available 24 hours a day, 7 days a week. I have businesses calling me and at all hours of the day. So just a reminder, kind of again to piggyback off what Nancy just said, please, when people are wearing either their masks or taking on and off gloves, please don't drop them in the parking lots. Please don't drop them on the streets. We still have businesses that are just seeing used gloves and things everywhere, and it's not safe for anybody. It's not safe for their workers. It's not safe for the public. So please make sure that you are depositing them in the proper receptacles or taking them home to deposit or reuse, okay? So just a reminder to the public that it's just unacceptable. Please take those extra steps. I'm currently working on getting masks to our businesses for their staff. So I'm personally picking up and delivering where I can. I've been doing that the last couple days. And thanks to both Tom Roy and Kevin Kowalski, for helping me with this. But we want to make sure that our grocery stores and the people that are still out in the public on a regular basis are being safe, both for their own safety and also for the public at large. And a reminder to shop for 7 to 10 days in advance. I think you just saw recently on Facebook, but Fitzgerald's is now taking orders into the next week. It has nothing to do with lack of staff. I've been in touch with Brian every single day. It doesn't have to do with lack of staff. They just cannot maintain the volume with delivery, stocking the store, all of the things that go in necessary. And they do still have people that are ordering delivery, 1 bag 3 days a week. Please make sure if you're going to shop, you shop for 7 to 10 days if you're doing delivery. They still offer in-store. You can go in-store and pick out things, and they're also offering the curbside pickup. But for delivery, they are about a week out right now.
Sarah, I appreciate that. And that's a great reminder. And I can tell you from personal experience, Brian is running around filling carts up just as hard and as fast as the rest of his staff. So they're working around the clock on that. And also, I can confirm based on. Go ahead.
Go on.
No, go ahead.
I was just going to say, we also got, for example, we got John Hampton and others reaching out to us asking if volunteers can help. Again, I was in touch, and after these past public safety phone calls, I know that the Visiting Nurses Association said that they could deliver, and DPW said they could deliver. But again, the delivery portion is not the problem. It's not the lack of people. It's just the lack of manpower and supplies to keep the stores stocked.
Yep. No, and I appreciate that. And I can also say, based on your email traffic and Facebook activity, you really do work 24 hours a day, so we appreciate that. Make sure you're getting some sleep.
Randomly, but thanks to all. This group is really amazing, and I think we've tried to be as proactive as possible.
Absolutely. All right. Any questions for Sarah? Sarah, thank you for all the hard work. All right. Chris Peterson or any other peers of mine on the phone. Updates, questions, thoughts?
This is Chris. No, thank you, everyone. I'll stay out of the way.
All right. Anything else that needs to be discussed this morning? All right. I appreciate everyone's time yet again. I know everybody's busy, but again, I think this is a really important connection point for the community. Maria mentioned that they're filming updates for the community as well, and I think this is the other portion of where information is getting out. I'd like to continue to have these, so we'll plan again on next Thursday at 8 a.m. And again, once hopefully the need for these will cease to exist sooner rather than later. But I appreciate everyone's time. Is there anything else for the good of the order this morning? All right. Thank you all. Stay safe. We are adjourned.
All right. Stay safe.
Thank you.
Everyone.